Do you want me to ask you some
Yeah,
questions?
you had some questions.
Okay.
Let's handle that and then.
Okay, let's see. I got Mom's phone because mine's recording us right now.
Oh, hi.
Okay, so the first question, let's see. How long do you think the quarantine will last?
Yeah, no, I don't have a crystal ball.
Right.
So being able to look into the future is difficult. But here's some facts about the common cold. And as we said before, the coronavirus, whether it's COVID-19 or COVID number 2 or any one of them, has a seasonality built into it. Now, I don't know that COVID-19 absolutely will,
Okay.
since we haven't gone through that yet.
Right.
However, when the humidity comes up and the temperature goes up, the virus tends to die off. It tends to have a seasonality. The cold and dry of winter into the early part of spring, and that's cold and flu season. It's also the other part about this virus, I think we're close to it anyway, is that it seems and appears to be treatable. And as we already have referred to the younger population being more resistant to it, there may be ways of actually boosting the immune response without getting crazy and without doing terrible things. They do it all the time in cancer therapy.
Okay.
So it's not like it's a new thing to do. And they've been treating viruses one way or another for years. I mean, you can go back to when they were still using mercurial, so and other compounds. There are ways to bring it under control. I think those studies have got to go forward with as much vigor as they're trying to develop a vaccine.
Okay.
And that part of it should be shared with the public.
Yeah, well, I
mean, there's disparities where the geography seems to be controlling something, where the population seems to be either more or less vulnerable, where the treatments are more or less working. So there's a whole lot of stuff happening. I didn't actually answer the question about how long do I think it's going to last, because like I said, I really don't have a crystal ball. But if the coronavirus that we're dealing with here acts like coronaviruses have in the past, probably another 2 to 4 weeks, maybe 6 weeks is a good bet before they start saying, okay, you can go about your business. I'm banking on it between 2 and 3 weeks.
Yeah.
I think that's my gut feeling.
And that would be us in this lockdown state where we can't go anywhere and things.
And everybody goes back to work. Everybody lives their lives and deals with this the way they would deal with a cold anyway. Good nutrition, proper hygiene, all the stuff you need to do to keep your health going.
Right. Well, it's actually, I'm going to jump to a different question because you sort of talked about this, but what vitamins, supplements, food source immune boosters can people take? And I guess in general, and then people who are sort of immunocompromised or older, like, do you have suggestions of what people could take?
Well, almost all of the medical studies that they've done, objective studies that they've done with supplements, don't show there's a majorly difference between using them and not using them if you have good nutrition.
Okay.
People who are relying on vitamins to be a substitute for the good nutrition for mostly vegetarian menu are probably making a mistake, but you have to mix and match it. Okay. Antioxidants make sense. There's a lot of proprietary vitamins out there making health claims that they can't sustain. They're almost always done with an anecdote, or somebody says, "Oh, I used to walk with a limp, but now I just talk with a lisp." But
trade one for the other.
Yeah, well, whether those vitamins actually do things, yes, they'll improve your immune system in several ways. You'll see an improvement.
What kind of vitamins are you talking about?
Well, I don't want to give a brand name out.
Okay. No, I just meant
I'm
like
not
A, B, C.
But I would go with the fat solubles, the KADE.
Okay.
And stay within the parameters, and the minerals and water soluble vitamins, which like vitamin C and others are simple, are also important. But like I say, if you drink orange juice or any fruit,
proper nutrition.
The proper nutrition, you're doing just as well as if you take a whole bunch of vitamins.
Yeah. It says immune boosters. Someone asked about immune boosters.
Immune boosters, that would be the same answer.
Okay. All right, let's see. Okay, let's go back to this. So, what happened in Italy?
Yeah. Or for that matter, what happened in China. Or what happened in Iran, or what happened in any area where they've had outbreaks. And unless I actually was able to look at the data and say I could give you an opinion, but it's an opinion. I can't offer any explanation other than they probably did not have the proper setup going in. They probably didn't do early on isolation. But it's all speculative. It's a hypothetical question. Why is it worse there and will it get worse here would be sort of a bridge too far. Again, we have a population that doesn't live under the same set of circumstances, that may have better nutritional habits or different nutritional habits, and may not have as open a border. I know that part of the problem in Italy was identified as the range of commerce they were having with Iran and with China that allowed for just open borders type of immigration.
Yeah.
And that might have been part of the issue.
Yeah.
I don't know.
Yeah, okay.
I really don't know.
That's fair. No, it is interesting how when you look at the map of the world, Italy's so small and the United States is so big. And I mean, we're already hitting 20,000 cases, but I mean, it's to be expected. There's so many people in this country.
325 million is that's not a big chunk of the population that's got positive tests. The test results that are being accumulated now are being done on people with symptoms. I think if they're going to really do an honest study, they're going to have to do it with people who don't have symptoms. But if you're using this...
And you are right. Like, if they're going to get accurate numbers and get accurate facts, they need to test everyone, and that's just not possible.
And it's not also practical.
No.
I mean, ultimately, I suspect this virus is going to burn out just like any seasonal virus would.
Yeah.
When that happens, it'll give time to come up with a good, reasonable response, and they can do more laboratory work on the virus to see why it acts as it acts and what to do about it.
Right, for sure. Okay, let's see. What connection does the disease have to SARS? Is it the same?
No, SARS and West Nile virus and H1N1 flu, bird flu, and H5N1 and all the rest of it. They're just seasonal agents that severe acute respiratory syndrome. You could see SARS in several settings, but things that affect the lung bed and affect the ability for respiration, for oxygen exchange and carbon dioxide exchange to occur, are life-threatening.
Yeah, of course.
So those just about any disease of the lungs.
Pneumonia.
Pneumonia is a manifestation of something like SARS.
Interesting. Or
COVID-19 or pneumococcus, or bacteria can cause it, and agents that you inhale can cause it. People that are exposed to chloride chemicals, bleaching agents and stuff like that can develop lung disease. People who vape, people who smoke, have inherently damaged the airway. And that airway, once damaged, becomes more vulnerable. It's not that hard.
Yeah. No, it makes sense. This person was asking me about there's a big disconnect between what's being said through the press and what's really happening in real time. People say they are having a lot of trouble getting the care they believe they need when the press is saying to call your doctor first and they'll handle the process. People are saying they are being tested for the flu and then sent home until they get worse and worse until it's too late. I guess this person just wants to know what's really happening. I feel like you already sort of touched on that.
I did.
Yeah.
Part of the issue with any, in this case, new agent, but the same concern existed right after 9/11 when anthrax was identified as an agent that had been deployed.
Right.
And in the state of New Jersey, there were altogether, I think, 4 or 5 cases. Actually, that included New York. But the treatment, Cipro, an antibiotic, was sold out of all the pharmacies because everybody went to get I need to have something at home and on call. That is a measure of public being frightened, of being intimidated by facts. And then putting yourself into what's known as the worried well class. What the goal was to stop the surge into emergency rooms and hospitals of people who were afraid that their common cold or that their process was anthrax. Right. So in order to stop, in this case, the COVID-19, in order to stop the process of a surge to a hospital, the advice has been rely first on a health provider, and we'll actually see what's going to go on. And if down the road you need to use it, well, the hospital will be there then, and it won't be overwhelmed.
Right.
So.
Well, now I know for New Jersey it's 211 for all information. Just seems like a lot of chaos because normally when you would get sick, you would just make an appointment with your doctor, whether you have bronchitis or laryngitis or the common cold. And then they see you, they put you on antibiotics, maybe, and that's it. But.
Which is what most people are reaching for. They want a solution, and they want to know that solution's available to them, and that they won't be denied.
I think people are getting so scared about tests as the first thing, and it feels like
feels like that's the first thing you
right.
want to do.
Right.
But I still think, like I said, I was educated before light was invented. So
Not true.
Well, I graduated at a time when it was still appropriate to talk to the patient, for the physician to be hands-on, to listen to their breathing, right. Use a stethoscope and know what you're listening to, not through a shirt, not over the telephone. Telemedicine, I don't know how that's going to work.
I know, it's hard. I mean, they're doing it to
you had to
protect
look
people.
at a throat. You had to feel for lymph nodes. You had to look at the lining of the nose. You had to look in the ears. You had to look in the eyes. You had to touch the abdomen. You had to do a decent history and a good physical. And then you could either tell somebody, look, here's what we're going to do and here's why. Right. Versus, don't call me in the morning, take 2 aspirin. Right. And, all of these range of choices in an age of healthcare reform, I don't see it as improving delivery of care to patients or people. Right. In general, education is good, but experience with it is more critical.
Right, and it is. This is something we haven't experienced in our lifetime yet, at least.
No.
So it is uncharted territory.
This is novel, and like I said, the fire has been flamed by throwing a little bit more gasoline in it.
Thanks to the media.
Yeah.
Oh man, no, I know. I mean, don't get me wrong.
I can see it in my own family. It's hard to reassure you, hey, there's nothing really to worry about.
Hi.
Yeah, well.
I'm here. Feeling a little nervous. Every other day, there's one point in the day where I think maybe I have coronavirus. And then I'm like, oh my God, I gotta leave because I can't get you and mom sick.
Yeah, well, you're not. Yeah, it's what I told you. I said, this is a common cold. Yeah. It's just a variant. And it is something that we have to be careful. Yeah. But, and not necessarily casual. I'm not being casual.
Yeah, I know.
But
and that's what I don't want people to think. I don't want people to think that, we're just here to shed some light, start some dialogue, maybe address some of these, because these are ethical questions too, and they don't necessarily have answers,
And it's hard to ignore it, especially when we have to sit at home, look at our feet, and do nothing other than try and, hey, what are we going to do today?
We could do a puzzle, Dad.
Yeah.
Let's do a puzzle when we get off this.
I'm ready for that.
No, it's good. This is good. And ultimately, we're all doing our part. We're staying clean. We're staying home. We're, doing the social distancing is working. It's slowing everything down. We're keeping in touch with our family members. Being with the people that we need to be, hopefully. And
hopefully everybody has access to, a food supply and a clean place to live and stay. And
New York Post reports that half of confirmed New York City COVID-19 cases are having gastrointestinal system issues. Did you hear this?
GI is not a big surprise. Take a look at coronavirus.
Right.
Having a GI component would not be unusual, especially given the way those viruses are sort of surface related. They go to the moist surfaces in your sinuses and in your nose and in your throat, while the surface of your stomach and your gastrointestinal tract is pretty moist. Indeed, we make more mucus in our gastrointestinal tract than we make in our nose and sinus.
Interesting. Yeah. Do you have any stay-at-home tips to treat respiratory and GI symptoms? Because it seems like we're going to be home. A lot of people are going to be home taking care of themselves while they're sick, you know.
Well, just what would you have in your home to address the cold or a nausea or stuff? Over-the-counter stuff is fine, and if it goes beyond the way those medications work, if you're having that much of an issue, you should seek medical care.
Yes, and that was the next question. What are the red flags that indicate you shouldn't wait it out and require medical assistance?
Anything. Sustaining a fever would be a big clue.
Yeah.
But worsening of any kind, if you started to get not just changes in the color of the mucus that you were secreting, but if there was blood, if there was,
right.
If there was anything like that, and if you had at the same time a measurable loss of appetite, weakness, and inability to do normal daily activities.
Was always the same thing that you always ask us when we said we weren't feeling well? What are your symptoms?
Yeah, where does it hurt and how long does it hurt?
Right, fever. We sort of talked about this. Does age matter?
Yeah.
We talked about our kids are basically unaffected, right?
Kids have a stronger immune response.
There's like 6 kids that just rode by on their bikes.
That's good. They're out there exercising.
Yeah.
But the process of age segregation in this does not appear to be simply immunologic.
Okay.
But kids have gotten over it. The article that I showed you this morning, that even in China, the very young appeared to be not just resistant, they got over it.
Right.
So it acts more like a common cold in certain age groups, and in other age groups it's acting more in a more complicated way. But that's just part of the 3 dimensions that you always see in medicine. It's rare that one problem has one cause.
Right.
And if a person that's taking multiple medicines for a complex disease picks up a set of symptoms, immediately the thought is, well, is this a side effect from my medication, side effect from the disease that we're treating, or something new? That kind of thinking really requires some help from a professional. And so it's not just an age-related disorder, but it appears that some groups are spared more than others. You'd less likely think of pregnancy in a man. It's just, do your stomach hurts? Yeah, it's not pregnancy.
Well, that's one thing it's not.
Well, that's the whole point is you have to look at the set of circumstances, the clinical history as it develops, the patient's medication profile, their age group, and their risk factors.
And of course none of this is being addressed.
Right.
Because when you're just tests, it's just blanket. And that's a whole other, again, more of the ethical thing, and that's another super
section.
Complicated, but interesting. So, do good health conditions matter? Yes, we've talked about this.
Yeah.
Be healthy, exercise, do what you can.
In fact, that's probably more critical than anything else.
Okay.
I would go with good habits that include nutrition, exercise, cleanliness, and the things that you would do just
sleep.
And sleep. Yeah, of course.
Sorry, go ahead.
The things that keep you strong.
Yeah.
That's absolutely true, including the way the immune system responds to rest.
Well, I think that's a huge takeaway with all of this, is that everyone can benefit from just being healthier, being active, I know, I'm going to have to stop that in a second. Be active, your nutrition, your health, how much are you drinking, how much are you smoking, like even people my generation who sort of just do that carelessly because we can, take a step back and really think about how can I be healthier.
Yeah, less price.
Right, because at the end of the day, we all have to take care of ourselves and our health, and that's something that you always preached in your practice.
I know.
Preventative
Well, that's a good message
care.
to end this on.
Yes.
Yeah.
Yeah, for sure.
For sure.
Anything else you want to say? Here,
No,
wait.
we're good.
You can keep. We're still going. We want to say something else, Dad, to close.
To
To close, I don't know. I still have more questions, but we can.
We'll save it for our next session.
Yeah.
This is gonna put a lot of people to sleep. Anyway, so.
I don't think so.
All right. Well, we'll see.
Anything? Okay. So thanks for listening. Mom's coming in now.
Dinner time.
It's dinner time.
Okay, it is dinner time.
We are. Thanks for watching and listening. And anything in conclusion?
No,
Doctor?
just stay healthy, stay well, stay strong, and don't worry about this. Don't let this run your life. Use your sense to keep
To keep it.
keep
in
it
check.
in proportion.
Yeah.